Okay, we're all set.
Okay, I'll call this meeting of the Administration and Finance Committee to order. All 5 members are present. And moving on to item C is new and previous matters. Item 1, an ordinance codifying code changes related to the 2021 approved budget. And Ms. Grill had sent us an email specifically saying what changes need to be done.
Mr. Chair,
Yes, Alderman Lysick.
I would make a motion to amend the ordinance 2A to read direct and supervise the functions of planning, zoning, and housing programs, and 2B direct and supervise the staff assigned to the planning, zoning, and housing programs.
We have a motion from Alderman Lysick. Is there a second?
Second from Alderman Weigel.
Second from Alderman Weigel. Any discussion? All in favor say aye.
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 Opposed? The ayes have it. And then are there any other changes that need to be made to the 2021 approved budget?
Mr. Chair, the other items were outlined in the rest of the ordinance. They're basically just the changes to specifically the Department of Development, the Economic Development Department, Planning and Zoning, and the Housing Department. So those are outlined in the ordinance. You are considering with the amendments adding the housing to the 2 sections.
Right, thank you. And that was in our agenda packet, correct?
Yes.
Yeah, thank you. So can I have a motion to approve the items as listed in the agenda packet?
Motion to approve.
Second.
Second.
We have a motion from Alderman Tenorio and a second from Alderwoman Keene. Any discussion?
Mr. Chair,
Yes, Ms. Grill.
technically it should be approve as amended.
Thank you.
Thank you.
And Alderman Tenorio, you make that motion to approve as amended?
Motion to approve as amended.
And Alderwoman
Second.
Keene, your second as such. Thank you. And then any discussion? And then all in favor say aye.
Mr. Chair, Alderman Weigel.
Yep, go
Mr.
ahead,
Chair.
Alderman Weigel.
I just have one question. As I was reading this, it seems like the director of whatever we're calling this department now, is he still acting under the authority of the council, or is he essentially, it seemed to me, and I'm looking for the red change here. I can't find it right now, but when I was reading it earlier today, I just want to make sure I understand. Previously, the head of this department could be terminated under the direction of the council, but is that authority still there, lie with us, or has it been given to the city administrator?
Mr. Chair,
Yes, Ms. Grill.
the way that this was structured, as I understood from the adopted budget, was that this position was not having a contract with the council, that it would be a managerial position. These positions would be managerial as they had been previously. So direct supervision would be to myself. However, we all report to the council, so termination could occur should the council desire it.
Okay, thank you. I just wanted to have clarification on that. Thanks.
All right, we have a motion and a second. Any further discussion? All in favor say aye.
Aye.
Bye.
Opposed? The ayes have it. And then first off, before we move on, is there any further action required under item number 1? And then moving on then to item number 2, a discussion regarding updating the City of West Dallas salary schedule related to the 2021 approved budget adopted.
Mr. Chair,
Yes, Ms. Grill.
this is basically on the agenda today just to inform the committee and the council that at the next council meeting, we will have a new salary schedule that will include certain changes that were made according to the budget, including a zoning administrator and process liaison, community engagement coordinator, housing navigator, and deputy city clerk. All these positions are currently being classified by Carlson Detman, and we will have the salary grades available in time for the budget, in time for the agenda, which will come out on Friday for the council meeting next Tuesday. So I just wanted to let the committee and the council know that this would be coming up next week. So no action needs to be taken on this. It's just a discussion.
Okay, thank you. And are there any discussion or points or questions from anyone on that issue? All right, then we'll move on to item number 2. No, excuse me, item number 3. We just completed item number 2. Item 3, resolution relative to approving a contract with Anthem for stop loss coverage for the March 1, 2021 to February 28th, 2022 year.
Mr. Chair.
Yes, Ms. Grill, you're on a roll. Keep going.
Okay, thank you. We have Taylor here from Horton that's going to be presenting information regarding the 2021-2022 benefit information. So she would be covering items 3, 4, 5, and 7 in her, or I'm sorry, and 8 in her presentation. So it might be, if you would just entertain her giving the presentation now and take action after, or if you want to read all of those items so there can be discussion, whatever the committee prefers.
Sure. I don't think we necessarily need to read them all, but yeah, we'll take action after the presentation from Taylor, because I don't want to try and pronounce your last name, Taylor. I'm sure you've heard that one before.
I have. My maiden name was Wisco, the first 5 letters of Wisconsin. So easy. And then now Nairangi. So
Very good. Yeah, and then we can, you can feel free to please tell us about all of those items that might be appropriate, and then we'll take action afterward also as is appropriate.
perfect. Thank you very much to Ms. Grill and the rest of the committee for having me this evening. I believe Ms. Grill had sent out a packet of materials for everyone to review prior to the council meet or the committee meeting this evening. So I'm going to start with page 1 of that, which is going to be the medical renewal projection for March 1st of 2021. And just to kind of at a really high level, right now things are going very well from the city's medical plan perspective with Anthem. And we have already been able to get the administrative renewal from Anthem. So initially they had projected a 5% increase to the administration cost, and we were able to get that down to a 2.5% increase from Anthem on their administration cost. And then also from Serviu, who is the prescription drug vendor for the city, they were able to hold their administration fees for the city of West Allis. And those are what I would call firm renewals. And then the stop loss that was mentioned in the agenda, we have received an initial increase to the specific stop loss insurance of an 8.9% increase, and then an increase of 5% to the aggregate stop loss insurance coverage through Anthem. So kind of what that means from a high level perspective from the increase in the stop loss is about an 84%, or excuse me, an $84,000 increase in stop loss premiums. So if we're still taking a look at page 1, all of those dollar figures are listed at the table to the right-hand side, where we're listing out what is called the fixed costs. So all of that information is shared with you there. And then if we just direct our attention to the left-hand side of page 1 in those materials that Ms. Grill had shared with everyone, if we wanted to just walk through the renewal projection, that would be great. I'm going to kind of try to keep it high level, but if anybody has any questions and you would like to dig in a little bit deeper, I'm more than happy to field any additional questions that you have. So for purposes of our budget, we wanted to make sure, especially with the COVID-19 and some of the changes that were made to the city's health plan on March 1st of 2020, that we were capturing 2 12-month periods, so 24 months of claims history. So you'll see there are 2 boxes, one from November 1st of 2018 through October 31st of 2019. And what we had done was we had pulled those claims to the tune of $11.9 million. And then we had subtracted it out, any of those stop loss reimbursements or prescription drug rebates that were paid by Serviu. And then we had weighted those claims, just because with medical inflation, I'm sure a lot of you have read and heard about medical costs just going up year over year. So we had trended those claims. And then also just actuarially, when we're looking at claims retrospectively, we put less weight on further back claims than we do on more recent claims. So we're having about a $2.3 million in claims that we're showing from 2018 to 2019, those dates that I had mentioned. And then if we look at the box below, we're talking about claims from November 1st of 2019 through October 31st of 2020. And we had started with about $10.2 million worth of claims, again, subtracting out any stop loss reimbursements and rebates. And then we're getting to our claims reimbursement of about $1.9 million. So we're also then weighting that amount at 80% after we do trend it out. So then we're looking at about $7.8 million. So then the number that we're actually using then for our claims experience is roughly $10.1 million in claims experience. And then any questions at all before I'm continuing to move forward? Okay, perfect. I'll take that as a no. Thank you. So then what we do is, because as I mentioned when I kicked off, there were some plan design changes on March 1st of 2020. We are taking that into consideration. So there's you'll see a subtraction of $390,000. And then below that, there is a COVID-19 adjustment factor. So as I'm sure a lot of you have read or heard about on the news, there has been a dip in claims due to COVID-19, especially when we look back to April, May, and June for the city. Claims were greatly deflated in comparison to prior years during that time, as a result of people not going in for care, just due to the clinics and hospitals just not really seeing patients. So we are taking that into consideration, just because we would hate to be in a situation where we think that everything is smooth sailing and then we have a blip and we have some of those claims that didn't take place show up on the claims experience and then skew everything. So then we are building in the stop loss and admin fixed costs, which is that 1.698 figure. And you'll see that same figure on the box on the right-hand side of the page there that we started talking about during our discussion. And then we're just adding in additional fixed fees for, HSA contributions or health risk assessments and some of the other items that are offered as part of the city's health insurance offering. And then we're getting an estimated claims plus expenses at $12.4 million. And we're bumping that up in comparison to the income or the funding for the current plan rates of 13.6 and showing a decrease of 8.76%, projecting ahead for the plan year that will start on March 1st of 2021. Any questions or comments at all on the budget explanation? Okay, again, I'll take silence as no questions. So even though we are projecting an 8.76% decrease, it is the Horton Group's recommendation to actually just hold the funding rates as well as the employee contribution rates flat. So if you turn to page 2, you'll see a table that outlines all of the rates for health insurance along with the respective FTEs or full-time equivalents for the health insurance. Thank you for sharing your screen. I appreciate that. So you'll see that table, and all of those rates are reflective of the rates that are currently being charged today. Just as I mentioned before with COVID-19, we're unsure from a medical perspective of what that means moving forward. So instead of reducing the rates just because we have had COVID-19, and there's actually some articles and stuff that we're reading now, and some industry trend information that's saying currently claims are looking towards the downward projection again as COVID claims are spiking. And then who knows if you're going to have a COVID case on your actual health plan. So if you do, and they're in ICU for an extended period of time, it could eat into that increase, or excuse me, that decrease that we're showing. I have a group, for example, that had somebody who was hospitalized for 6 weeks, and that was over $500,000. So we're just trying to be very conservative and recommending that we're holding the rates as they are today.
I had a question.
Yeah, of course.
So just to clarify, the PPO plan is less of a premium than the high deductible?
Yes. So the reason for that is because the PPO plan is on a narrow network. So you're only being able to access Aurora as well as Pro Health facilities. And the PPO plan that has the HSA is Anthem's broad-based network. And so that's the reasoning behind having the premiums be higher for the PPO plan than, or excuse me, for the HSA plan than the PPO plan.
Thank you.
Of course. And then any further questions at all on the medical? All right. And then the dental plan is also, we're recommending a 0 for the Anthem dental plan, and Care Plus is at a 0% increase. And then the vision plan is currently in a rate guarantee. So we're not having a renewal at this time for that specific line of coverage. All right. So that pretty much sums up the status of the health plan and the dental and vision as it stands today. We do anticipate that Anthem will be releasing the firm and final stop loss numbers in the next couple weeks. And as soon as that information is made available, we will be sharing that with Ms. Grill and the rest of the city administration team so that we can just, what I will use insurance jargon, lock in on that one particular piece of the puzzle. All right, so on screen, you will see the Family Savings Plan savings summary. So this is page 3 of the materials that Ms. Grill sent out in anticipation of the committee meeting this evening. And the Family Savings Plan is a alternate plan for employees and retirees of the city of West Allis who do not want to have coverage through the city's health plan, but to take coverage through their spouses, or maybe if you're an adult child and you wanted to take coverage under your employer health plan instead of remaining on your parents' insurance, that you have the ability to do so. And the incentive for that particular person or family to take the coverage underneath their spouse's employer, for example, is that the city would pay for the additional premium charges as well as the deductible or coinsurance or copay expenses for that particular person or family. And the reason why that is beneficial for the city of West Allis is because you're having the ability to move that risk off of your health plan and have that employer of the employee spouse, for example, take on that risk. And does anybody have any questions before I kind of dive into the overall numbers of the savings? Okay, perfect. Again, I'll take silence as no questions. So as it stands today, there are 18 subscribers, and subscribers is insurance jargon for either the employee or the retiree. And then total enrollees is just every belly button. So every man, woman, and child that is going to be covered under the plan. And as you'll see under the active section, which is the top bar at the table that's shown on the screen, you'll see that there's 14 subscribers that are actives, so current employees that are taking advantage of Family Savings Plan, and 53 total enrollees. So when we're looking at the total number of people, the actives make up about 77% of those subscribers and about 85% of the total membership. And so they're really a driving force behind the Family Savings Plan, as well as the total savings. So underneath the subscribers and enrollees counts of 1453, you'll see the premium equivalent savings of $139,658. And that is money that the city didn't have to set aside to pay for health insurance for those subscribers and their family members from March of 2020 through August of 2020. So for this, it's a 6-month snapshot. This benefit was implemented on March 1st of 2020, which is why we're just looking at the 6 months of data. Then next you have the Family Savings Plan cost of $37,979. And the Family Savings Plan cost, that's going to be the administration cost that the city pays on a monthly basis for this this plan, as well as those deductible or co-insurance or co-pay charges that I had mentioned that the city picks up as kind of the incentive for the employees and the retirees to take advantage of this program. So then you have the net savings. So you're taking the 139 minus the 37, and then you're coming up with $101,679 in total savings. And then you have what's called a shared savings fee. And this, in addition to the flat, $25 per employee per month charge that Network Health Plan has, they retain 35% of the savings. So basically they're sharing in the savings with the city as part of their overall administration cost. And then, so you have a total savings for your actives of $66,091. Now, in addition to the total savings that you have available, there's also avoided claims. So as part of this program, the retirees or the active employees have to submit their evidence of benefits, their EOBs, to Network Health Plan. And so Network Health Plan is tracking and seeing how many claims or the dollar amount of those claims would have actually hit the city's plan. And that would be $94,031. Or really, what would it be equivalent of 96.7% of the total savings that you'll see down on the bottom, which is $97,199, which is great in terms of all of the claims that we were able to avoid in experiencing on the city's health insurance. I'm not going to go into the retirees or go dive into them as a combination, really, just because we spent so much time going through the actives, and unless anybody would like me to walk through each category specifically.
I think we're okay. You can go ahead and move on to the next one.
Perfect. And then last note on this page is just that the rates, everything is guaranteed until the February 28th of 2022. So no renewal or anything like that for the committee to have to go through and approve. The last page is going to be the Go 365 engagement. So Go 365 is a wellness platform that the city has in place for the non-collectively bargained employees and their spouses. And as part of that program, there are currently about 326 subscribers that are on this platform. And there's actually 56% engagement. And engagement is taking a look at everybody who is at either silver, gold, and platinum as of November 30th of 2020. So when we're taking a look at the City of West Allis's engagement in comparison to their peer group, the city is at 56% engagement and the peer group is at 22% engagement. So really fantastic engagement and participation by the city employees and the family members that are covered as part of this plan. The next little section on the page that everyone is able to see, the key program completion, that's just looking at the health assessment completion, which is going to be an online questionnaire, and 75% of everyone has participated in that. And then the biometric screening is going to be, going into the doctor and having your annual checkup completed. That is currently at 62%. So all of those components, the health assessment, as well as the biometric screening, those activities have points associated with those that, feed up into the engagement that we looked at the top of the page. So again, I really can't say it enough. The city has been doing a very good job with getting the engagement and the participation in this program. And then the last component of Go 365 is just a renewal update, and the administration cost is actually decreasing 5 cents per member per month. So it's going from $4.04 down to $3.99. Any additional questions on Go 365 and the engagement or the program as a whole?
Mr. Chair,
Mr. Chair.
And I think Alderman Weigel was first.
I just had one question on the family savings plan. How are we doing against, projected versus reality on enrollment and actual dollars saved?
So the actual reality for participation and dollars saved, I'll address the participation first. With the city having this go live on March 1st, and most employers having their open enrollment kind of either July timeframe, if you have schools or those types of employers, they're looking more at like a 7/1 renewal, or most other private employers are looking at a January 1st renewal. So we do anticipate that we are going to see some of those enrollment totals tick up for the family savings plan after the first of the year. And then to answer the second part of your question, Alderman, for the savings, they are real savings because we are not having those people on our health plan and having those claims that would have hit our health plan. And then as well as those premium equivalent savings, those would have been dollars that the city would have been setting aside for those health insurance, rates, if you will. Now, the fact that you're self-funded, your actual real tangible dollars are your stop loss dollars. And so those stop loss dollars didn't get paid out to Anthem, nor did your administration cost for Anthem. But it's really those claims dollars that the city would have been setting aside that are now just basically being reallocated to cover the costs of the deductibles, co-pays, premiums, etc. for the other employer plan.
Mr.
Did that
Chair.
answer your question?
Oh, I understand. Well, I understand what the plan is about and how it's supposed to work. I'm just wondering how we were doing as far as how we thought the participation numbers were going to be, and if we missed the mark, what we can do to bring those up. I understand, that the timing and the March, and now we're in an open enrollment period for a lot of businesses, and obviously COVID has affected a lot of this stuff too. But my question is, did we save as much money as we thought we would? And if we missed that mark substantially, what can we do to get enrollment up? I mean, I assume all the employees were made aware of the plan. Did some of them find it maybe too complicated? That's my question.
Yeah, I think that the numbers that maybe came out a little less than we were kind of thinking, but I think that the two items that you had said, COVID, as well as just the point that was made about the timing of, that January 1st or July 1st renewals have impacted that. And then also next, I think an impact is that this is probably going to be very appealing to recent hires, because with this plan, you're basically looking at the other health systems. So as I mentioned on the call earlier, the city's network is Aurora and Pro Health. And so if you have already switched all of your doctors from, Columbia St. Mary's or Wheaton, for example, then you might not be as interested in the family savings plan. So I think as the plan is in place longer and there's more and more new hires that the city is bringing onto the plan, that's going to help increase the numbers that are participating even more. So I think, just continuing to communicate it to existing employees, as well as getting that new blood, if you will, into the city's employment group. And from a claims perspective of of course. And from a claims perspective of savings, I think that in correlation with the amount of people that are covered, we're on target.
Okay, and was there someone else who wanted to be recognized previously?
Mr. Chair,
Yes, Alderman Lysick.
I just want to point out that we have several newer members on the council that may or may not be aware of the Goal 365 program, how it works, is they were not in the council when this was implemented, and they don't have access to the health insurance, so they wouldn't be aware of what the Goal 365 program is or what it requires our employees to do. So I think maybe a real brief explanation of that, so the newer members of the council understand what that is.
Sure, I would be more than happy to do a high-level overview of Go 365. So Go 365 is a platform where the city employees and their spouses are to engage in specific wellness activities through the Humana Go 365 app and portal. And you are able to earn points in a number of different categories. You can earn points for your physical activities. So if you're, wearing a Fitbit or you're going into a gym on a daily basis or, weekly, however frequently you're going and your gym is set up with Go 365. Or there are educational opportunities where employees can do different sessions, if you will, on Go 365 or calculators, things like that, where they're accruing points. And all of those points have a value to them for different activities that you're completing, and that gets you to different categories. So you'll have to forgive me, I don't have off the top of my head, but I believe platinum for a single is 5,000 points. And so as you go throughout the year, you're earning points in all of these different categories. And the reason why you want to go ahead and do all of these different activities or educational opportunities or complete your health assessment or your biometric screening and earn these points is because there's a mall component. And on the mall, you're able to have these points, which kind of correlate to bucks, if you will, or dollars. And then you're able to redeem your bucks for, gift cards, for example, or you can earn a Trek bike or all of these different types of wellness related goodies. Oh, thank you for pulling that up. Okay, so sorry, silver is 5,000 points for one individual. And then, the city is responsible then for funding those redeemed points or bucks that are taken advantage of through the mall. And really just the overall goal of the program is to get people healthier through engaging them in various wellness activities or, having them take some personal responsibility in their health by keeping active. I know personally, when I've been in programs like this, I pay attention, oh my gosh, I've been sitting at my desk all day. I've only taken 1,200 steps. I need to get up. I need to move around. I need to be more active. Just so that way you are kind of creating more of that culture of health and wellness. Does that, Alderman, help answer kind of what you were looking for?
Isn't there some requirements that they do a biometric screening and that they see their doctor?
Yes, so the biometric screening, those points do feed into your, bronze, silver, gold, platinum status. You do earn a very large chunk of points for doing your biometric screening that you do through your primary care provider. However, you don't have to do your biometric screening program. It just makes it a heck of a lot easier to get to platinum, for example, if you do your biometric screening. Go 365 has it set up such that you can do a variety of different activities or educational opportunities to earn points. So if you do your dental checkup or get your eye exam, for example, it's really supposed to kind of be a holistic program.
Mr. Chair.
Yes, Ms. Grill.
I just wanted to add on to that. We do use Go 365 to track if people have completed their health assessment and their biometrics, because if people do that, if the employees do that, they receive a lower premium. They pay a lower premium share for their health insurance. So this is a way to help us track it, and it's mutually beneficial because the employee would also receive points.
Thank you, Ms. Girl. That was very helpful.
Mr. Chair,
Mayor Devine.
if I could just add, of all the irony in this discussion, I'll vouch for the program because my Garmin Venue that I ordered through Go 365 just arrived on my porch this evening. So the timing is perfect.
Very nice.
Especially during COVID, people need an excuse to get out and get busy. And I think, the Garmin's or the Fitbits or the Apple Watches, whatever, help people realize how much we've been sitting in our houses. So I'm glad yours arrived. Are there any other questions, comments at all for me as it pertains to the medical or insurance benefits? All right, perfect. I will take your silence as we are good. And we, as I mentioned, will keep Ms. Grill and the rest of the team apprised once we get the final stop loss locked in for any further motions by the committee as well as the council.
Okay, thank you very much for that. So then for item 3, a resolution relative to approving a contract with Anthem for stop loss coverage for the March 1st, 2021 to February 28th, 2022 plan year. Is it appropriate to take a motion on that? Are we ready to act on that?
I move for approval.
Second.
We have a motion and a second, but I want to hear from Ms. Grill first, please.
I just wanted to advise the committee that we have a not to exceed amount in there because, as Taylor mentioned, we are still waiting for the final amount from Anthem. But at this time, I'm comfortable with the not to exceed amount. We should be within that amount. At least that's what's been presented to us previously. So in my opinion, it would be fine to go ahead. Thank you.
Thank you. Any discussion? All in favor, say aye.
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 Opposed? The ayes have it. And then item 4, a resolution establishing the health insurance plan with Anthem as the third-party administrator, funding levels, employee premiums, premium share, health savings contributions, and participation in the retiree active rate option for the plan year, March 1, 2021 to February 29, 2022.
I move for approval.
Second. Tenorio.
We have a motion from Alderman Lysick and a second from Alderman Tenorio. Is there any discussion?
Mr. Chair,
Alderman Lysick.
I have one question for Ms. Grill. Again, this year, the retirees had the big surprise in late summer where they got their bill for the premium that were missed early in the year. So they get this bill for, depending on what the rate is, several $1,000s for health insurance premiums that weren't deducted previously. This has happened for a couple of years, I think probably 3 years now, and we thought this was corrected. What are we doing to ensure that this doesn't happen again next year?
Well, I apologize, but this is the first time I'm hearing about that problem occurring this year. I know that it had been a problem in the past, but I thought that we had, the council had approved the increases in time last year to get everything done. I don't know.
It didn't.
Okay.
It didn't get done.
Okay. I don't know if Chris or Richard have more knowledge of this.
Rebecca, it's Chris Moan. Honestly, I don't know that I know exactly what we were talking about. This is the first I'm hearing of this. Can somebody either loop me in either offline or tonight? I'm honestly not familiar with what we're talking about here.
Yeah. In the past, I believe the issue was we had considered the rates at such a time that when the letters had to go out to the retirees, we didn't know the increases at that time. So because it's a month ahead of time, so we had to play catch up with them. I had believed that we had solved that problem by having the council consider it earlier. So that's
Right.
what it's about.
Okay, I knew that happened the first year and I thought that was right. There was some sort of like delayed enrollment process. I wasn't aware it happened ever after that, but maybe I've been out of the loop on that.
Yeah, Mr. Chair, we'll have to look into this a little bit more, and I apologize for not having an answer at this time.
I apologize for bringing it up at this time. I just happen to remember it. Somebody had called me a couple of months ago complaining about that it happened again this year. And I told them I'd check into it at the appropriate time. So as long as we're on discussion on this, I thought this is the appropriate time to see if there's anything that can be done to prevent this from happening. Because it comes as a surprise for people on fixed income to suddenly, be going along paying their premiums every month and all of a sudden they get a bill for $2,300 saying, oops.
Correct.
And,
yeah.
I know there's a program that requires some coordination with the state for public safety officers where they can get it.
And that's what it is. It's public safety.
Okay. Well, okay. That, again, just the logistics maybe of that helps explain a little bit to me of what you're talking about. I thought it was a billing issue on our end. Okay. It's the coordination of those rates with.
Correct.
Okay. Because those actually are processed by ETF and then kind of passed along to us. Okay. I at least understand the issue now.
Okay, good. Thank you.
Yeah, and maybe if you can follow up offline and get an answer for Alderman Lysick and just include the rest of the Administration and Finance Committee on that answer, I'd appreciate that.
We can, for sure. And Mr. Chair, if you don't mind, I was going to go through what's in the resolution for those people that might not be familiar with all the different components. Taylor went through a lot of the rates and such, but I just wanted to go through what's in the resolution, if that's okay.
Yes, please, go ahead.
Okay, so the resolution that you're considering for approval includes all of the premiums that were presented by Taylor earlier, the health insurance, dental, and vision insurance, as well as setting the health insurance premium contribution for those who participated in the biometric HRA completion, which is at 12%, or 20% for those that did not participate. There are collective bargaining agreements that have different levels. I believe the police are at 14% contribution. The next item that's contained in the resolution is the contribution to the health savings account for those that participate in the high deductible plan. There's a $500 contribution for single employees and a $1,000 contribution for family employees. And the last item has to do with the retirees rate option. Last year, we called it option 1. Essentially, last year, there was a significant increase for retirees that the council approved an option, whereas they could receive the active rates and then they would have to forego healthcare after they became Medicare eligible. So this is including providing that option going forward for people that retire. So those are the different components of the resolution that you are currently considering. Thank you.
Okay, thank you. Is there any further discussion on item number 4? We have a motion and a second. All in favor, say aye.
Aye.
Opposed? The ayes have it. And then item 5, I think that's a discussion regarding Go 365 engagement. I think we already had that discussion. Can I have a motion to place that on file?
So moved to place on file.
Second.
We have a motion from Alderwoman Keene and a second from Alderman Tenorio. Any discussion? All in favor, say aye.
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 Opposed? The ayes have it. And I think we can skip ahead to item 8. And item 8 is a communication from the city administrator regarding the family savings plan. That's related to our insurance discussion. Do you have anything to add to that, Ms. Grill, or what are your thoughts?
There's nothing further to add at this point.
I move we place on file.
Second.
We have a motion from Alderman Lysick and a second from Alderman Tenorio to place on file. Any discussion? All in favor, say aye.
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 Opposed? The ayes have it. And then moving back now to item number 6 is a resolution related to the creation of policy number 1446A, disclosure of sensitive information.
Mr. Chair,
Ms. Grill.
if I could just provide a little background to this policy. Previously, when we had, before we had the reclassification, the classification and compensation study done by Carlson Detman, we had employees classified as confidential. When the study was implemented, we did keep the confidential classification in our ordinance, but we did not have any confidential employees. We didn't classify any positions as that. And I talked with Kale about different options of classifying people, if we should revert to the confidential classification, or if there was a different way that we could address that, because there's other information besides collective bargaining agreements and certain personnel information that can be confidential or not confidential, but they certainly are sensitive information. And so such as people who are taking sick leave or FMLA compensation, disciplinary matters, other leave info. So this allows us to classify positions as those who are dealing with sensitive information. And so they would have to adhere to the policy where they don't release any information to anyone except their supervisor or someone that they need to perform the their duties to related to that information. And if they would release that information outside of a record request or a court order, they could be subject to discipline. So this is really formalizing what people should not be doing with certain records they encounter as part of their job duties.
All right, very good. Can I have a motion to approve item 6?
Motion to approve.
Second.
I have a motion from Alderwoman Keene and a second from Alderman Tenorio. Any further discussion? All in favor, say aye.
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 Opposed? The ayes have it. And then item 7 is a resolution amending the fees for ambulance services provided by the West Dallas Fire Department effective January 1, 2021.
Move for approval.
Second.
We have a motion from Alderman Lysick and a second from Alderman Tenorio. Any discussion? Chief Pooler's on the call here or on the line. We can make him talk. No, all in favor, say aye.
Aye.
Opposed? The ayes have it. All right, and then we already addressed item 9, or item 8, excuse me, so we'll move on to item 9. And item 9 is considering compensation and performance evaluation data for city officials and deputy assistant service employees. And that is our closed session agenda item, and I will read us into closed session. For agenda item 9, the committee may convene in closed session pursuant to the provisions of section 19.851C of the state statutes, the purpose of considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility. Can I have, or the committee may reconvene in open session after the completion of the closed session to consider the balance of the agenda. So can I have a motion to move into closed session?
So move.
Second.
We have a motion from Alderman Lysick and a second from Alderwoman Keene and Alderman Lysick.
Aye.
Alderman Weigel.
Aye.
Alderman Tenorio.
Aye.
Alderwoman Keene.
Aye.
And the chair votes aye. And so we are in closed